So I just got back from one of the most inspiring conferences that I've been to as a patient in my entire career of patient advocacy and going to conferences. And I want to talk about it. So, hey everyone, welcome back to my channel. I recently went to the National Organization for Rare Diseases, their Rare Disease and Orphan Drug Product Breakthrough Summit, or the NORD Breakthrough Summit. That was in Washington, D.C. This was actually my first rare disease conference to go to as a patient, and I've been to a lot of different conferences before for inflammatory bowel disease and Crohn's disease, but I've never been one that's just been specifically for rare diseases. And I didn't really know what to expect. I've been to a lot of conferences, in the world of inflammatory bowel disease. The conferences that we typically attend are pretty big. There's Digestive Disease Week and the AGA conference and AIBD. These are bigger conferences. And so I wasn't really sure what to expect from a rare disease conference. I didn't know if it'd be, on the larger side. I didn't know how many people would be there. And so I was excited. I was excited to go and to have the opportunity to go as a patient, as an advocate, as somebody obviously who lives with a rare disease, and to just get involved in the rare disease community in this way. And honestly, it exceeded my expectations. And so it wasn't huge, right? I mean, there were probably, I don't know an exact number, probably 800 people there, maybe, give or take. And everybody there was either somebody from an advocacy organization, some patients, there were providers, there were other like caregivers, like people who were touched by rare diseases, people who were involved in rare disease care, people who ran nonprofits, and then there were people who were part of the FDA and the NIH and some of these bigger, health organizations that really do things that can impact a lot of patients, but especially rare disease patients. And so it was a really cool conference that I just wasn't expecting to be so inspired. Honestly, I didn't know whether it would be a lot of science, a lot of research, a lot of updates, patient stories. I didn't know what the mix was going to be really until I kind of got there. And what I thought was cool about it was that every big session of the day really started with a patient story or like a caregiver story. And so they would start off kind of the sessions with these stories of whether the first one I went to, kind of the keynote opening, was 3 different people affected by rare disease in some way. And the first one was a rare disease mom who lost her child to a rare disease, and that really kicked off her kind of career in patient advocacy and the work that she's done. And she unfortunately lost her child to a rare disease, and her story was just phenomenal. And she talked about the advocacy work and being involved. And I shared this in a different video, but she's the one who said, when it comes to advocacy, that it's exhausting to lay bare our pain for everyone to see. And that's just such an impactful quote from somebody who does the advocacy, who does share their story of living with a rare disease and living with Crohn's disease. That these diseases come with so much. They come with heartbreak and exhaustion and just so much. And the disease itself is exhausting, but telling your story and advocating and just laying it all out there is emotionally exhausting, mentally, physically, it's exhausting. And we do it because it's important work, and we share our stories because it's important. But as she said, that quote really just hit home with me, because it is exhausting to lay all of this out sometimes, just because we're reliving some of our own trauma. But it is important, and she emphasized that. She said it's important to do this work, to share your story. And her story of losing her child, and I can't imagine, but to losing her child to rare disease. And then I think she was saying a few years ago that there was a treatment approved for the condition. I can't remember the condition, but it was obviously her child has passed away several years ago, and the treatment was approved after her death, and she got to see that approval. And a lot of the work that she did and was part of helped get that approval done, that medication out there, and that treatment. And it was powerful. It was a powerful way to start off the conference. And then heard from 2 more patients after that. One was a medical student. One was somebody who was diagnosed with Huntington's disease, and and talked about her story of triumph through that and everything that she went through. And the conference was about health equity and diversity and equity, and basically making treatment access equitable for all patients, all rare patients, and making sure that they have access to that care and everything that they need. And a lot of these stories were around that. And so it was a really cool way to start off each day by having those stories told. And there was another patient who lost the ability to walk, and then was able to regain that ability. And just to hear these stories of triumph was just so cool and so inspiring, because it really connected with me, right? I mean, it's similar to some of the stuff was similar to me and the things that I've gone through as a rare disease patient. And then we got to hear from some really cool people that work for the FDA and the NIH. And we heard from the deputy director of CMS and the FDA commissioner. And these are things, you don't often get to be in the room with these people and to hear what they are doing in terms of supporting rare disease patients, and how patient stories are how the patient stories and things that they hear are, really helping their work. And it's just cool to get that inside look of what is going on at these, like the FDA makes huge decisions about drug approvals, and CMS makes big decisions about coverage guidelines and all this stuff. And to know that they both were physicians, and they had been in actual patient care. They were physicians before they worked in the FDA, and they use that experience and bring that to the table and take that into consideration. But it's also cool to hear like all of the red tape and things that even they kind of have to go through. And I know for the rare community, there are only 5% of rare diseases that have an approved treatment. So 95% out there do not have a treatment at all. And that's a big thing in our rare community is how do we get to how do we get more treatments for diseases, right? And one, they have to be developed, right? I mean, there are diseases that are hard to treat, that are hard to develop a drug for, but then they have to get approved. And there are extra kind of barriers in place for rare diseases. Part of that is that for a lot of these diseases, there's a small number of patients. And for drug approvals, typically, you want to have huge trials. You want to have a lot of patients enrolled so you can get robust data and ensure that this drug is safe and effective. But in rare, that's not always the case. I mean, I was going through some of the kind of the exhibit halls, or some pharmaceutical companies there talking about the work that they were doing. And one of the trials for the drugs that they were in only had 15 patients in it. I mean, that's all they could get. I mean, there's not that many patients out there with that specific disease. And so that's a huge barrier in rare is these trials, and getting enough people, but realizing that you're not going to have as robust trials. So how does the FDA, how do they account for that? And what are things that can be done to supplement that information? And they were talking about AI and these, the world of AI and these different kind of computer models and things that we can do now to give us a better look of what it would look like to have like the same information and drug in these bigger trials, and to make approvals based off of that. But they talked about how they make those decisions and considerations and things that can be done to ensure that the drugs and everything are still extremely safe and effective and get approved. But there are a lot of barriers in rare. And then there was a lot of talk about diversity and inclusion in clinical trials, diversity, equity, inclusion in clinical trials, which is huge. It's important, and every clinical trial should be diverse and be inclusive and be equitable for patients. But there was one thing that I thought was interesting, as they were talking about how in rare, again, it's hard to get all of these patients, and because oftentimes there's not a lot. And they talked about how they want to see as much diversity and inclusion, equity inclusion that they can in trials. They want to see it. We have to see it. We need it. But in rare, we can't let that be a barrier to getting a drug approval across the finish line. And I thought that was interesting. That there are just these things, these extra considerations in rare diseases that we just have to kind of take. And we have to continue to fight for diversity, equity, inclusion in trials, especially the bigger trials. But in rare, they can't let that kind of get in the way of getting a drug across the finish line and getting it approved. And it's just another example of how hard it is to get drug approvals and everything in rare diseases. And so there was a lot of talk about approvals and data. So it was such an empowering conference to be at, and I got to talk to so many people. There were people from the industry, pharmaceutical industry, those who hadn't always gotten to talk to rare disease patients, and I was able to share my story with a few of them. And but then also there were some people there with those companies that were in those jobs in the rare disease space because they were affected by a rare disease, because they have a child with a rare disease, or they had a rare disease themselves. And there were a couple of kind of clinicians that I talked to, and again, their children had rare disease, and they got into this work because of that. And so it was just a really cool atmosphere. I felt like I was surrounded by so many people who were all there, obviously, with one common goal, and that's to help patients and to really change the landscape for rare diseases. And it was a powerful conference. And I had the opportunity to travel to DC, which was cool. And I was there with NORD, the National Organization for Rare Diseases. I was there on behalf of them, and I can't say enough about how this conference was. And I've been to a lot of conferences. I've been to some huge conferences for digestive diseases, and honestly, kind of the difference about this conference, in my opinion, is the inclusion of those patient stories and those caregiver stories, like the inclusion of having them every day before kind of each session made a huge difference and an impact. There were people crying in the audience. I mean, we heard from two parents. I told you about one of them. We heard from another one whose child died at 13 months or 14 months old from a rare disease, and she ended up getting a PhD after the fact and works now in academic research. And because of what she went through with her child, and those are some of the most impactful stories that I've heard, and not just as a rare disease patient, but as a parent. It's tough to hear. I can't imagine what parents go through in that regard. And so just to hear those, I mean, to start off the conference that way is just an incredible way to do it. I think all of these conferences should do something like that. And there were, then there was a good mix of kind of some of the updates for policy. There were some newborn screening updates. There was all of the information that we got from the FDA and the NIH, and some CMS information. It was just a really good mix of things. And it was a smaller conference overall, but it packed so much into it, and was just, again, so inspiring for me to be there and to be around all of those people, and to see the work that's being done. And there were a lot of patient advocacy organizations that I was able to connect with, and that I'll share on some of my social medias about, and list some resources that they had. And it was just a good mix of so many things. And that also was a little different, in my opinion. They had a whole hall designated for patient advocacy groups. And you could walk down it, and all these patient advocacy groups and organizations were there, and you could talk to them and see what they were about, and get the information. And some of them there was one I talked to where they provide free flights, free to medical care for rare disease patients. And so that was also different. They had a whole hallway lined up with these patient advocacy organizations there, that was just for them to share the work that they do, and to connect with them and provide resources. So I thought that's not something I've seen at a conference either. And so it just did a lot of things right. And I didn't know what to expect, and I was unsure of how it would be, and what all we would hear. But it exceeded my expectations, and I left feeling so inspired and so proud to be in the rare disease community, and the work that is being done, and the work that I can hopefully continue to do. But I just wanted to share a little bit of my experience from this conference, because it was so impactful for me, and it's something that I will look back on as kind of a really big moment in my rare disease advocacy kind of career so far. I hope that I get to go back again, but it was just such a cool experience, and I'm grateful that I was able to go and to share that with you. And as you've seen throughout the video, some of the clips and pictures of things that were at the conference, it was really incredible, and I can't wait to bring more and to share more of those resources, and continue to connect and raise awareness for the rare community and the hypophosphatasia community. So thank you for watching. I hope that this helps, give a little insight into what I was able to do, and what's happening in the world of rare diseases from the FDA and the NIH and all of that. And there was just so many updates, and there was a lot on gene therapy, and that's a big thing. And so I want to do more videos on some of the smaller topics, not smaller, but some kind of shorter videos on those specific topics. But I just want people to know that there's a lot of people out there working for rare disease patients and really trying to change the landscape, and the work that's being done even at the government level. While we don't always see it, it is happening, and there's a lot to come, especially in the gene therapy world. And so I hope that you're inspired and you have hope, just like I do after leaving this conference. So thank you for watching. If you have any questions, please let me know. Please, would love to like and subscribe so we can connect. But please let me know if you have any questions, and thank you for watching again, and I hope that this helps in some way. But thank you guys, and I'll see you next time.